Imagine trying to juggle multiple medications for several medical problems. Sounds daunting, but the growing field of medication therapy management is there to help. In this week's Real Men Wear Gowns, we see how MTM has affected one patient's life and how his relationship with his provider has made all the difference.
This is just an incredible program that is very personalized.
Mike Nevela has several health issues. He takes 2 blood pressure medications, a digestive medication, a cholesterol med, and he suffers from insomnia.
But it's hard for the average person to understand all these medications, how they work, and how they interact with each other. So at one point, my general practitioner had recommended that I see someone in the MTM program.
A one-on-one meeting was set with Dr. Ann Moyer.
We want patients to come see us so that we can help them to better understand their medical conditions and their medications.
When Mike started treatment 6 years ago, the two met about 4 times a year. But now that his health has improved with better medication management, they only meet twice a year.
Our focus is the medications, but we do also talk about health and exercise, diet, activity, things like that. Those lifestyle changes are very important in helping to obtain your health goal.
That term coach is just a good way to put it. It's very personalized. We're never rushed.
And when a patient and doctor spend that much time together, it's more than just looking at charts and filling prescriptions.
My provider, Ann Moyer, has just been outstanding. I consider her a friend. She goes above and beyond what I think she's required to do.
Which has all made a world of difference for Mike.
I feel very healthy, thanks in part to MTM.
And medication therapy management is available to all health partner members, even without a referral from a provider. And it's just worked great for Mike. I mean, he takes a lot of medications, but they work with you so you know what you're taking, but also to help you get off some medications if possible.
Which is so key. And he was so positive about it. You can tell he really just feels good about his health situation, which is great.
He's in a great situation now.